when it comes to CBD dosing, what is a good CBD dose? Like if we're sort of more or less excluding THC from the equation, and we're using it either for say anti-inflammatory effect or epilepsy or anxiety, what is the dosing that you would use? Both in practice and from the literature, there's some controversies out there. Let's talk about the anti-inflammatory effects of CBD. It's stated that CBD has about 20 times the effect of aspirin, or about twice that of hydrocortisone, and in some citations, it's actually THC that gets that quotation. Is it both THC and CBD that have that, or is it one or the other? And how good is that that statistic for equivalent dosing equivalence? And I think from what I could research, there isn't a lot of good guidance on that specific statistic. It's been claimed and sort of put out there a lot, and there might be some validity to it, but I don't think there's a lot of good data to back it up. However, that being said, if you made an assumption about, like, you want to dose CBD for anti-inflammatory effect, and that you want to assume that's true, that then say like aspirin, like 500 milligrams or about 650 milligrams actually, about 4 to 6 times per day is an anti-inflammatory dose for aspirin.
Well, hold on, because that high a dose of aspirin, you're at a strong increase for bleeding and GI bleeds.
Very true. Very true. And it's at actually high risk for salicylate toxicity as well. That puts it on the edge of the 4,000 milligram general limit for aspirin for pain. However, the off-label uses for aspirin specifically for inflammation range up to 7.3 grams.
Oh, wow.
So between 2.1 to 7.3 grams is the inflammatory dosing for aspirin. That's off-label. Anything above 4,000 milligrams is way off-label. But 650 milligrams, 6 times per day is 3,900 milligrams per day. It's the sort of absolute limit.
Okay, so then what we need to do is we need to clarify, okay, because we have aspirin, we have NSAIDs, we have COX-2s on the market, and I don't know how, we haven't even talked about I guess COX-2s at NSAID, and then we have cannabis. So I think we need to differentiate.
Okay. So there's aspirin, which is an anti-inflammatory that has a number of other properties. It's a mixed COX-2 inhibitor that also tends to thin the blood by affecting the platelets and reduces the ability of platelets to bind, and that's how it thins your blood. NSAIDs, generally speaking, like ibuprofen, meloxicam, ketoprofen,
your Vioxx, your Celebrex, right?
Well, Celebrex gets into the COX-2 inhibitors.
Okay.
So the mixed COX inhibitors are things like ibuprofen, naproxen, ketoprofen, things like that. And so there's COX-1 and COX-2. COX-2 is what we call inducible. It's inducible. So usually by direct injury or whatnot, that's how it actually is activated. And so we thought as drug scientists that by producing COX-2 inhibitors, we would target the inducible portion of the pathway. That means that when you are having active inflammation that's due to injury or exacerbated, like bone on bone rubbing, that targeting COX-2 would be a safer way of creating a drug. So that's where they came up with the COX-2 inhibitors. They were intended to be safer versions of NSAIDs that had fewer side effects because they did not target COX-1. Turns out, not the greatest idea, because those COX-2 inhibitors seem to actually increase heart attack and stroke risk, especially in patients vulnerable to it. So NSAIDs, generally speaking, increase heart attack and stroke risk. And we hoped that we would get better side effects with COX-2 specific inhibitors, but we actually increases the heart attack and stroke risk. Oopsies. Now, THC and CBD mostly don't seem to affect the COX system specifically. They affect it via slightly different pathways, although CBD and THC do affect the arachidonic acid cascade, which, again, we're getting into sort of word soup, but that's sort of a similar cascade to what's happening with aspirin. Is immobilization of arachidonic acid is one of the first sort of cascading effects that happens with an NSAID, and sort of like is some of the rate limiting steps that just cause all the other things to fall into place below that. But THC and CBD and other cannabinoids are not COX dependent inhibitors that reduce inflammation via other mechanisms than cyclooxygenase. So COX is just cyclooxygenase. It's a specific enzyme. And THC and CBD mostly don't operate through that.